This process is not easy at all. It's time consuming and it can be long for many people. So, what has been the hardest part about applying to Perio residency? What's been the hardest part about this process for you?
For me personally, one of them was just staying focused, knowing exactly what I wanted and trying to narrow that down, especially because, once you get out of dental school, you got this looming of, oh, I got all this money I got to pay back. I need to get a job, you know, considering residency alone, because a lot of them are paid. Some of them, you can get a little something back, but, you're spending extra time that, when you're young, you think that is, a lot more than what it is in your grand scheme of your whole career, an extra 3 years to compare to the 20, 30, 40 years that you may be practicing isn't really much. Um, but, that hardest part was really wanting to commit to, okay, this is exactly what I want to do versus, I could just get a little bit here and there as a general dentist and dibble and dabble. But that and just staying focused and not being discouraged. So I had some discouragement. I didn't just get in right away.
No, can't. No way. No way. No discouragement. Doesn't exist on planet Earth. No.
Yeah, so had to take some hits to the chin. And, humble yourself and just stay focused. And that was probably about it.
Perio. Perio. Perio is the foundation of oral health. It serves as the nexus between oral and systemic conditions and where millimeters matter, right? Millimeters matter.
Yep.
Stay tuned as we talk to a doc who just matched at his top program for periodontology. Stay tuned. Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and then life as a new dentist. Guys, thanks so much for joining another episode just for you. Make sure that you are sharing, liking, subscribing, commenting, but also support the channel so that we can continue to bring all this information to you. Different ways to join down below. All right. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com, which we're going to be talking about today. Dental Residency. GetIntoDentalResidency.com, your ultimate resource to help you match this cycle, just like Dr. Andre did. He's going to tell you how. But for more details, go down below, right down here, and check that out. And hopefully this will help you as you look to match into your ideal program this upcoming cycle. So today we're talking to a good friend of mine, even though he joined the wrong fraternity from 1911, but it's okay. He got the year right. He just got the colors and stuff wrong. But all jokes aside, former outstanding resident who's now getting ready to be a resident again, but this time as a specialist. Today we're joined with Dr. Andre Artis, better known as Dr. Drip, better known as Dr. DJ. I don't know, Dr. DJ Drizzle. I can't keep up with all the...
just drizzle.
Just drizzle, right? No rain, just drizzle. And he's going to share with us about his journey to PERIO, how he prepared his application, the number of schools he applied to, and why. Interviews, some more information about the interviews, his rank list, how he ended up selecting his program, his ideal program, and he's going to be giving some advice. So guys, make sure that you are staying all the way through. Don't cheat. Stay all the way through, because you never know when some drizzle is going to be dropped so that it'll help you, and it can really help you with that, a tip and a strategy that's really going to help you. So without further ado, Dr. Drizzle, Dr. Andre, please introduce yourself for those that are meeting you for the first time. Tell us a little about yourself, where you're from, and all that good stuff.
Well, hello, beautiful people. I'm Dr. Artis, or DJ Drizzle. But yeah, I went to school at Meharry Medical College. That's where I did my undergrad training. From there, um, I went into residency at Bronx, Lebanon, which is now known as Bronx Care. There I did 2 years. My first year, I knew I just wanted more training to get better in general dentistry. But as I was there, I had a lot of specialties there, being able to interact. I advise, going to at least a GPR, doing some extra training. It will very much so benefit you.
See, he's dropping drizzle already. Look, just started. We dropping already. Go ahead.
From there, I got to work with the periodontist, and I got to work with oral surgery. Got to work with the endodontist. I mean, that was one of the fields I was kind of looking into as well.
Yep.
That showed me that I don't necessarily want to do endodontics. it's a good field. I just don't want to do it.
Right.
Pediatrics. So working with the periodontist and the oral surgery, that kind of narrowed me down to I really, really enjoy PERIO and all the aspects that come with it.
Yeah.
And so from then, that's when I started to try to apply to get into PERIO. So it's a background on me.
Yeah. And what are you doing now? Where are you at now?
Right now, I'm in St. Louis, Missouri. This second year.
The SLU.
Yeah, down in the Lou. So.
Yeah, absolutely. So you mentioned a little bit about your experience as a GPR resident and having exposure to specialists and people that have finished a specialty program. That's what I was trying to say. And how that, really helped you to kind of explore specialty training or but also give you a little bit more experiences as to what help you figure out what you didn't want to do. So at some point you figured out PERIO. So let's talk about that. Why PERIO? Why PERIO? And I know a lot of people are asking the same question because
why would you do that?
Right. It's like why are you gonna haze yourself again? Like from dental school where you had PERIO and it was, I know my PERIO experience.
Because I had a lot of people around me like, why are you doing PERIO? Like, you sure you want to do that?
Right.
Kind of discouraging.
Right.
For me to do it, but I was focused and I knew that's what I wanted to do. I mean, PERIO, especially coming out practicing and GPR and seeing different fields from Nashville to New York to where I'm in St. Louis, it's a common theme that people are plagued by this disease. It's kind of like a health epidemic going on within the United States, and I definitely wanted to be a part of helping solve and educate people about this, quote unquote silent disease, because often you don't necessarily feel it. I mean, it's the foundation of dentistry, basically what you're doing. So, all your other stuff that's built on top of that, ultimately can fail if your periodontics is not under control. And plus, it just embodies everything that I really like most about dentistry. It's just very delicate, very detailed and research driven. It's got a nice blend of surgery and engineering and craftsmanship. It's a field that's very dedicated to like health, function, and sequestering disease. So, I mean, that was a no-brainer for me.
Yeah.
And then then it's just like one of those key bridges between medicine. It's like the internal medicine of oral health. And it also helps you address a lot of systemic things. So I'm in a unique position because my father was a cardiologist. I have a lot of health professionals in my family. My sisters are both medical doctors. So and my uncles are dentists. So I got to see the full, more of a full view of it. And PERIO was like that perfect intermediate of everything that I wanted to do. So
yeah,
there I am.
Yeah, that's interesting, and I like a couple of things that you shared as to why, because it's important to know that you're right. Perio is that foundation, so much so that it's one of the leading causes for many of us as oral health practitioners getting sued.
Man.
Failure to diagnose, right?
Yeah.
Or to properly diagnose, and document the periodontal condition to the extent that the patient understands, right? Because we already know we get this all the time. Hey doc, can you just clean my teeth? I just need to clean it. Nah, Miss Jones, ain't too much left to clean. I can't clean your bone because I can't clean your teeth because there's no more bone around to support it. Like, so and you're right, it is a silent disease. It doesn't necessarily have to hurt to mean that there's, destruction on the horizon, or that there's things that are going on that are not positive, right? But
Correct.
that notion of that failure to diagnose is so important. Uh, State boards will look at your documentation and
Yeah, it's
and
like, wait
and
a minute.
wait a minute, right? There's no perio charting. There's no perio diagnosis.
Yeah.
Uh, uh-uh. It
Period has
don't
actually made me better at diagnosing. So the more I've delved
absolutely.
into it, I've been able to treat the patient more holistically. So that's
Absolutely. It is the foundation. Last time I checked, unless you got dentures, you need you need some bones, some stabilization with the bone. And even with
it's,
dentures, you still need the bone. Even with implants, you still need
it's
bone. So
something.
it's always been the foundation, and that will not change, right?
Nope.
Um, but I know there are some things that you did change this cycle, because I know that you've been pursuing this uh like, this is what you want to do, this is the decision that you've made, so you've changed the little things about your approach because you applied this past application cycle. So we want to hear a little bit more about some of the things that you did and how you prepared this application, because we know you did 2 years of GPR.
Correct.
What they don't know is that you also worked for a while too
Yeah.
before
Yeah.
applying in your cycle. So tell us
Yeah.
a little bit about that approach and how you prepared for your application.
So after I didn't get in right after GPR, I just wrote down the list of everything that I could possibly do to strengthen
Mm,
my application. Um,
mm,
one of the key things of doing that was talking to everybody that I could talk to. Um, you being one of the main point people, and just going from there, talking to every periodontist that would listen to me, um, talking to different schools, and trying to talk to different programs to understand, like what are they looking for, how I could put myself in a better position.
new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this this year. All right. But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com. Newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. We can help you. But you got to hurry up, because residency application is right now. It's right now. So shoot me an email right now. All right, let's get back to this episode.
One of those things was
No, I was
one of
gonna
those
say
things.
that just put a pin in it real quick. You mentioned you contacted programs.
Correct.
Now, this just came up with some clients that I had, and I was sharing with them. So that means that I know this is something that people are wanting to know. How did you go about contacting the programs? Because there's different ways to do it. But share with us the way that you did it and how you felt that that was significant or very or helpful.
Well, it was kind of a weird because it was kind of halfish COVID, halfish not
Yeah,
COVID. So a
yeah.
lot of programs, are not allowing you to come in person. So my approach of doing it was, I emailed the director, told them my interest, that I'm interested in their school and why I'm interested in their school, and then that I wanted to at least come and visit the program, and just trying to get as much information from them as possible, so that they, one, know I'm interested, two, know my name at least, so
Yeah.
they've seen my name at least one time, because sometimes a lot of it is, you can have really good scores, that helps, but you also got to interact with people for them to want to, if it comes down to a tie, it's like, well, I actually talked to this person versus
Yeah.
this other
Or he
person.
came to the program to visit it. I can put a face to the name now that I have his application several months
Mhm.
later. Like all those things matter.
It is.
Those
And a lot of
really matter.
programs, you have people just applying all over the place, and they have to pick the people that are really wanting to come to their program. They're looking for people to also edify their program. It's not,
Right.
um, you know, just the best candidate, but the best candidate for that particular school. So,
Yeah, that's key.
um, yeah,
That's
I
key.
just kept talking to wherever I could do. Another thing that I did outside of that is, um, in my stream of talking to people, I work at the dental school at ATSU here in St. Louis, so I'm a adjunct professor.
Mm.
I think that also kind of helped. One, I've always wanted to stay as close to the books as possible. So that's one of the reasons why I wanted to do it. Also, you get to be around other specialists, working out as GP. Sometimes you can get lonely and stay in your own little lane, and, not necessarily, um, hear about all the different advances, especially within all the other specialties, because that's not necessarily your lane. But that was very helpful as well. And
Yeah, and
then I
that,
took
and
as
that,
much as C. Oh, sorry.
no, I was gonna say no, that's a big plus. I know programs like because it is a curriculum and it is an academic program in addition to, being didactic academic program in addition to it being, of course, clinical, having that reference and
Mhm.
having that connection
Correct.
to a school,
Correct.
uh, that's great because that shows that you're teachable still, that you're on top of the latest hot topics and current events. And to be able to teach, that means you have to already understand, but also have a good, more than just a good understanding of the information that you're sharing. You have a working knowledge of it as well. So
Mhm.
um, all good strategies
Yes.
for this particular uh, subject, and also for this specialty as well. And you were mentioning something else that you did
Oh, and
application wise.
I just, bolstered my resume by, I took a lot of CEs and just tried to take as much as I could. I did an implant course, things that were very much so geared toward not only things I was interested in and that would help me within my private practice, but also, with that focus of trying to get into perio. So,
Yeah.
just here and there, just did whatever I could. So I know it gets expensive, but you know, I just saw at the end, like, that's that little money you're just water under the bridge at the end of
Oh
the day.
yeah,
So
because nothing is free, man. Even the
no,
application
not
process is not free.
not at
But
all.
it's an investment, everybody. It's an investment, right? You're gonna continue to invest in yourself. Hey, at the end of the day, the best bet is to bet on yourself.
Yeah, it's hard to
You
let yourself down.
no, you can't, right. And you have only person you have to blame is yourself too.
You gotta live with
Uh
your decisions. So
that's right. That's right. So that's a good point. Especially with the implant, especially with the fact that, currently there are a lot more periodontists placing a lot more implants in addition to GPs, in addition to oral surgeons, and
even endo.
even endo. There you go. So, everyone's is placing implants except for the hygienists. The hygienists are not placing the but they are providing some maintenance of those implants. But yes, great strategies for your application to enhance and also get ready for the next cycle as well. Also, part of that next cycle or step in the application cycle is really coming up with a list of programs, right? There are school-based programs, there are hospital-based programs as well. So tell us a little bit about how you approach that aspect in selecting your programs, and what were some of the factors that led you to focus on the list that you came up with?
Well, one of the things is like people. I went through and wrote down all the periodontal residencies that they have to offer, and then I kind of wrote down some things that I was looking to get out of the program, and then I was comparing and trying to compare and contrast, getting it down to a manageable list so I can continue, because that's a lot of money to apply to like 30 plus programs. So that, along with people that I knew that were in programs, how they were liking their programs, what they were getting out of it. I looked at definitely like research versus like clinical, which ones were more research heavy versus which ones were more clinical heavy. Of course, factored in lifestyle, where it was located. That didn't matter as much because being a periodontist superseded, maybe living in the sticks for a while. And then, if also I kind of looked at, their program as a whole, like if they even had people like me and, were they able to help align with the goals that I was trying to do after Perio. So, of course, also like a dental school being attached could be a pro, and it, could be a con depending on how many different specialties they have there, and what's the patient flow, could help, or the flow of patients. So
Gotcha.
those are the major things I kind of made a list of, and then of course I prayed about it.
Yeah.
So
Yeah, you got to talk to the dental guides about the process at all times, right? So you ended up with how many programs did you apply to?
I applied to 11.
11.
11 of
Okay.
them.
Okay. So after you apply, you have to wait a little bit, and then you get some calls, some emails about the next step, which is interviews. So tell us a little bit about your interview days, if there were any specific questions that were maybe a little bit different than you anticipated, and how many interviews did you end up getting out of the 11 programs that you applied to?
So like with the interviews, mine, it was all in person. I only got one. So I knew I had to, go all in and kill
You
that
only
one.
you only need one.
I only need one. That's all I
That's all you
needed.
need. That's all you need. But don't tell us where yet. Don't tell us where yet.
No,
We're
no,
gonna we're
no.
gonna
I'm
we're
not
gonna
gonna tell
wait
you
for
that.
that. We're gonna wait for that. We're gonna tell us. We'll do a reveal later.
Yeah. Um, so luckily that one was one of the top three schools that I was trying to get into
Good, good.
anyway. So
Yep, that was on your top three. Okay,
it was. But yeah, during the interview process, everybody was super, super friendly, very helpful. I got to, spend a lot of time talking to the PERIO residents, which I would definitely advise, when you get to any program, make sure you talk to the
yes,
residents, especially the ones about to
must,
leave,
must.
because, they also have some influence here or there, on who comes in, because you're in a small, my residency I was at, or I got accepted to, only has 3 a year, and so you have 9 residents altogether. So trying to necessarily bring somebody in that's going to disrupt that chemistry, and may not be advantageous. So if you are able to connect with these people, you're going to be with them for a while. That should say something about the residency, and who you pick and rank. But some wasn't a lot of surprise questions. I guess more of the thought-provoking ones were, kind of like, why now?
Mm.
Why Perio?
Now, you say why now? Why do you think they asked that question?
Um, because I've been out for a while.
Okay.
Um, and this program I didn't apply to the first go around anyway. So more of, like, okay, so why are you even coming? Because you're working and you're coming from a paycheck to zero, and why would you do
Right.
that?
Are you crazy?
Like, why would you? And you're gonna pay us, so
Right, right,
so
right. So
um
that makes sense as to why now,
yeah.
given that you've been working after 2 years of GPR and everything else. So, okay.
And I think they were also kind of probing to see, one, are you teachable? Because they're gonna teach you everything. It wasn't a whole lot of questions like, oh, name this whole complicated process of whatever, or name a procedure, because obviously that's why you're going to Perio to learn that. Of course, you need some basic understanding, but
So no clinical
I did have
situational questions.
I
I was
did
getting
have
ready to say.
clinical, situational, all that kind of
What was that
questions.
question? Go ahead. Tell us what that question was.
Well, one of them was actually from a resident. It was pretty thought provoking. It was like, well, if we had a patient that really needed some work done, but it was one of your co-residence patients, and it's a big procedure that is very hard to get, and that resident wasn't there, what are you doing? Or how would you proceed with that?
So wait a minute. So the
Um,
question was, if you have a patient that needs a procedure, was the treatment planned by somebody else?
yeah, so like your co-resident treatment plan, the procedure,
Okay.
they were supposed to do it. For some reason, they weren't able to do that, and it's been hard for that patient to get in
And it's on your
to,
schedule.
yeah. So now it's on your schedule. Like, how are you proceeding with that? Are you doing the procedure? Are you da, 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 how are
Ooh.
you going about treating that?
Co-resident interactions and
Yes.
love. So what did you say? Because this is a good question, because not only is it a a, a reality, a reality with programs, especially with people being out on vacation or sick or at another rotation, but it is also something that programs want to know as to how you interact and communicate with other people.
Kind of character you would have.
Yeah.
It was more so like, if it's, of course, first priority is the patient's health. So
Hmm.
if this is compromising their health at all, of course, I'm going to proceed and do it, because I'm not going to put somebody at risk. Um, but obviously, I would want to try and allow the co-resident to still do the procedure, because that's why we're here in residency, to get really good, especially clinically, at the things we are expected to do, and the generalists are going to be sending to us. So we don't want to be, poor with our clinical abilities. So,
Right.
it's one of those sticky situations. But obviously, I'll try to do whatever I can to help the co-resident, but unless it affects the patient's health, of
Yeah.
course.
911 call.
Yeah.
Dr. Smith, here, I got your patient in the chair. Let's go. Hurry up. Come on.
what
Come
you,
on. Let's
what you
go.
trying to do?
Where you at? You gotta let me know, because patient's ready.
Mhm,
This is the
mhm.
this is the fifth time this procedure's been rescheduled, but she's here today. What you want me to do? Let's go. So that makes sense. Any other like ethical questions, or any basic foundational perio questions that you should know as a candidate, or that would
You
be
should
expected to know?
know, like, the basic anatomy of the periodontium. I should say that.
That's right. That's
Yeah,
right.
that that's the field that you're applying to. So you should know the basics of what you're doing. So it's not just like, oh, I'm just out here, trying to do something just because it looks good, or I see people how their lifestyle is, or
Right.
whatever. So
So
yeah.
did they ask you any questions related to
Yes.
seeing if you okay, what was that question?
Just name some of the periodontal structures. I may or may have not had to draw a diagram. So
Hey, people want to know, right? That's part of the being prepared for the interview day, because I've heard some stories about endo and ortho that that supersedes and is more
wait.
more heavy than what you just shared for perio. So
Mhm.
you got to ask.
Yeah.
So being able to describe and
And
or possibly draw a diagram of the periodontum, periodontium from a slice
yes, from a
cross
slice.
sectional view.
Yeah.
Yep.
And even like knowing some current research,
Yep.
what's being studied, what's up and coming within the field, as far as advancement and where you see, like, how do you see yourself helping better the field
Yeah.
type
How you going
thing.
to
So
contribute not only to the program, but how you're going to contribute to the body of knowledge of periodontal.
correct. So
Periodontium. I can't say that
kind of
today.
having a direction of where you want to go.
Yeah, that's key. That's key, especially the research piece or the hot topics.
Yes.
So those that are listening, doesn't have to be just perio, but ortho, pedo, any of the specialty, you must know as a candidate, you must know the hot topics, the
Yeah.
current events. And if you don't know, then you can't be seriously considered that you want to be part of this specialty if you don't know those things, because they are all
So
open to dialogue and questioning at the interview, right? Right, Doc?
yep, 100%.
100%. I'm asking you that question. Program director's going to ask you that question,
They gonna ask.
right?
So,
You say you
mhm.
want to be a periodontist or you want to be endodontist, orthodontist, or sir. Okay, name me 3 hot topics in the profession right now.
Right now, go.
Right now. Go. 60 seconds. Go. Got to be able to do that, guys, gals, folks, future periodontists. You got to know. You got to know. So, interview went well.
It,
We ranked your list. And now it's time for the program reveal. Where's the music? Where's the music in the background?
let me get my
That
DJ
push
board real quick.
yo, DJ board, Dr. Drip DJ board. Where's the music? So drum roll, drum roll, drum roll. So where are you going to be taking your talents to?
I am keeping my talents in St. Louis. I got accepted into SLU, Periodontal Residency here. So
SLU, for everybody who's not from the area, I never heard of that term. What is that, please, so everybody knows?
St. Louis University. Excuse me.
St. Louis
I don't know why I'm acting
University.
like I knew what that meant until I got here.
I know, right? The SLU going to do perio. Now, is it 2-year, 3-year, 4-year program?
It's a 3-year program. Yeah, and they, they also have endo program, ortho program, pedo program. So, and they're very clinical based. So that's why it was in my top.
Awesome,
my top
man.
schools.
Well, congratulations. Pedo is like oral surgery and endo, where there's not a lot of positions every year.
Mhm.
Not a lot. So definitely need to be congratulated on that accomplishment and for persevering, right?
Yes. Yes.
No just
Absolutely,
means
100%.
no just means not right now. I don't mean no forever. So for those of you that are contemplating reapplying into a specialty cycle, it's a new cycle.
Yeah.
No last year just means they weren't ready for you last year.
Yeah.
Right? It's a new cycle.
And we
So
get new equipment for you. That's it.
That's it. Yeah, we had to wait to update the equipment for you so you apply this year and you can come in, whatever that is. But keep pushing.
Yeah. Don't
right?
close doors.
Don't close the doors. Don't close the doors, which is a great segue to the part that a lot of people want to hear now, which is tips, advice for future or current applicants, knowing what you know now and the process that you've gone through on your way to become a board certified periodontist. What are some of those tips? What do people need to know? Give us 3, at least 3.
Well, first off, majorly, especially if you're coming out of dental school, make sure you shadow a periodontist. You need to know like what that day is going to kind of look like, what you're actually doing, because people may think, oh, perio, and you think you're doing 100% surgery the entire time, which isn't necessarily true. And I would say just, talk to whoever you can that are in the field, see how they like it, kind of pick their brain. And then I would talk to schools, try to, if you can go in person, that's the best. If you can't go in person, then, at least email and keep in contact. Also try to see whoever that is a resident, try to talk to them as well. And then, really just honing into making sure that this, that's something that you really, really want to do, and how that's how you really want to invest your time and money. Because, on the flip side, you are taking a investment, taking a pay cut essentially, in some of your prime working years, to do this. So you want to make sure that this is something you really want to invest into yourself. But on the flip side, don't let money discourage you, because, at the end, the joy of doing what you want to do versus kind of grinding out and doing some stuff you want to do and not everything that you want to do, it's definitely going to pay off and reap dividends, for your overall happiness down the road. So
some great tips, man. Great tips. Yeah. Doing shadowing of those periodontists, making sure that you network and talk to periodontists is important. Visiting the programs, connecting with residents.
Correct.
Very important. And one of the ways that you can do that is also by going to the PERIO meeting.
Ooh. Which I went to.
Which you went to.
I'm gonna talk to the director.
Yeah, you got to go to the PERIO meeting, folks. If you're applying to PERIO, you got to go to the PERIO meeting, right? And then, connecting with residents, and then don't be discouraged, right? Don't worry about the fact that, you've been working, making 150 plus, and now you're going back to specializing where you may make half that, if that, for your training period. But again, as we said, we always say, it's an investment. If you're going to invest in anything, the best person to invest in is yourself, right? This is for your edification, but also for your ability to help more people as a specialist, as an expert with an expertise, and being able to help people, which you'll reap the rewards of that as well. You mentioned something, Doc, about being able to network with residents. Well, guess what? You're going to be a resident, so we need to be able to network and connect with you. So what's the best way to get in contact you?
Email. My email is my last name, Artis, ARTIS, .Andre, ANDRE, the number 4 @gmail.com. Just shoot me an email. I definitely will respond. So
awesome. Well, Doc, again, thanks so much for your time, and we appreciate your information. Congratulations.
Thanks for having me.
Yeah, staying in the SLU, don't have to go anywhere. That's good. That's awesome. That's awesome. Also, guys, these videos right here, these next set of videos, these videos are awesome as well. They're going to help you in some way or form. And that's our time. Love, peace, and smiles. Go to the next video right now. Go to the next video. Hurry up. Click.
Next assignment is go to the next video. Go to the next video right now. Go, go, go. Love, peace, and smiles. Go to the next video. Go to the next video.